I come from a background of having earlier been in the state Senate and then after that, the United States House of Representatives. And sometimes when I was a state legislator and it looked like we were making a hash of legislation on the Senate side, someone would say, well, let's pass the bill anyway, we'll clean it up in conference. It was always tempting. We'd just send it on to conference and hope that cooler heads would prevail and we'd get a better work product. Sometimes that happened and worked out well, and sometimes it turned out that we didn't clean it up in conference. And I'm reminded of that when I hear about what is being discussed and what now seems to be the clear plan for this Democratic majority and President Obama in moving forward with health care legislation. The House has passed a flawed bill with $1.5 trillion in cuts to Medicare, with huge mandates to the states, with tax increases, the largest increase really in entitlement, big government in my memory. And the Senate has passed its flawed version. Not only those flaws that I just mentioned with the House version, but also special deals, a special deal for Nebraska, a special deal for Florida and Louisiana, and on and on and on. And that's where we are now. The plan now seems to be that mistaken bill, that flawed bill that the Senate has passed on Christmas Eve, is now at the desk at the House of Representatives, and leadership over there is tempted to take that flawed product, pass it without any changes whatsoever, and send it to the President for his signature. The plan there is not the old legislative trick of we'll clean it up in conference. The plan is we'll clean it up in reconciliation. Well, as I mentioned, Madam President, sometimes that works and sometimes it doesn't. The problem with cleaning it up in reconciliation is that if this Democratic scheme goes forward and we do that, we will have not just a bill in conference to be worked out, where if a mistake is made, we can vote against it in the end. We'll have a statute. The plan is for the President to sign this flawed Senate product with all the taxes, with all the mandates, with all the special deals and purchases, sign it into law, and then hope that the Senate can correct all of those mistakes in reconciliation. If that scheme fails, we will be stuck with a very bad product, and it will be the law of the land and up to some future Congress to deal with. Certainly it will be the key, the top paramount election issue for the next several months. If the plan works, if the Democratic scheme works, we'll still have this. Maybe the Louisiana Purchase will be taken out, the Cornhusker kickback, the Gator aid, all of the special deals. And then we'll have the President's additional taxes and additional federal regulation that he has recently proposed. And when it's all said and done, even at their best, most optimistic predictions, we'll have massive funding mandates to the states. We'll have a $1.5 trillion cut to Medicare. We'll have huge tax increases and a large new entitlement program. The people don't want this. Now, I have some comments I want to make about what Senator Coburn called shenanigans, the reconciliation process. Now, let me just say this. Never intended for this purpose. An outrage, a non-starter. I will not accept it. Ill-advised, a real mistake, not appropriate, undesirable. Those are all comments of Democratic members of the United States Senate about the concept of cramming this bill through in this procedure that I've described and then coming back with reconciliation. It's not simply a Republican objection. It's an objection where we have our Democratic colleagues on record. I hope they will recall their words. I hope there's not some pressure that is going to be issued against my colleagues in the House and in the Senate to do something they don't believe in simply because someone really wants it in the White House and is exerting pressure. The comments that I have read were all made by Democrats. I happen to agree with that. We have never, under reconciliation, attempted something of this magnitude and this substance. And it would forever change the legislative process in the House and Senate of the United States if we begin with health care.